Thank you, everyone, and welcome to Exploring the Interdependence of Workforce and Childcare, our second session. And boy, have we put together a panel for you today. Thank you if you've joined us last time. We will have one more of these in August. And I think this has been a great success because we're finally getting into the issues that we will confront in workforce as we proceed with limited funding, with more funding pointing to training as opposed to childcare and other supportive services. So our effort today is to give you a little more information about not only policy affecting families, but what's out there that we can manage and what's out there that we have to, the challenges that we have to face. And many of us already know that, but I think our presenters today are phenomenal. You're going to enjoy them. We're going to introduce the speakers, but then I'm going to ask you guys to answer some polling questions. And so let's get into the introductions, and then I'll get to the poll after you guys tell us a little bit about who you are. We'll proceed with the presentation. Thanks again. Our presenters today include Jessie Kelly. Jessie is on the ground, boots on the ground, workforce specialist in Borderplex. As you don't know, that's the El Paso region of Texas. That's our farthest point to the west, and beautiful, I might add, with the mountain. Jessie Kelly, project specialist for them, working specifically in family support department in advancing equitable access for childcare, expanding upskilling opportunities for working parents. Big key here, upskilling. With over a decade of experience in program management, project management, including leadership roles in the public, private, and military service. Thank you, Jessie, for being an Air Force man among us. Appreciate you. Jessie brings a solution-focused approach to workforce development, strategic planning, and community engagement. A proud military veteran, he is passionate about aligning childcare assistance with career advancement, initiatives to help families achieve long-term economic stability across the Borderplex region. Thank you so much. We also have with us today a dear colleague of many, many years, Robert Knight. Bob Knight, you'll hear me refer to him as Bob. And Bob is the Director of Government Relations and Workforce Policy for Equus Workforce Solutions, a division of APM, a human service corporation, worldwide operation. Knight is responsible for federal workforce policy, including Workforce Innovation Opportunity Act and temporary assistance for needy families. He provides legislative analysis and technical assistance to Equus and its customers. Before joining Equus, Bob served as 22 years as president of the National Association of Workforce Boards. And thank you, Bob. I was a member in those days. He provides legislative analysis, technical. Oh, sorry, I skipped a line. Before the position, he was professional staff member of the U.S. Senate Subcommittee on Employment, Poverty, Migratory Labor, and began his career as a workforce planner in Milwaukee, Wisconsin. We all begin somewhere, don't we, Bob? I was actually an intake specialist for CETA, summer jobs. We all got our start somewhere. And last but not least, we have Dr. Ruth Friedman. Dr. Ruth Friedman is a senior fellow at the Century Foundation. Dr. Friedman is a national leader on early childhood policy, 25 years of experience in family, child, public policy, deep subject matter, political expertise, strong record for achieving major policy wins that improve the well-being of children and families. President Biden appointed her to serve as the director of the Office of Child Care at the Administration of Children and Families in the U.S. Department of Health and Human Services. Appointed during the pandemic, and we all remember how risky that was for the child care industry. She led the Office of Child Care to rapidly, strategically deploy relief child care programs across the country at a critical time for the sector and for families, leveraging more than 50 billion, that's billion with a B, in child care funding to lower costs for families, improve the system supports for providers, and build higher quality environments for children. Dr. Friedman led the early learning agenda for the U.S. House of Representatives for more than a decade before that, led numerous child and family policy efforts on behalf of Congressman George Miller out of California and the House Education Labor Committee. Dr. Friedman's background is a PhD in clinical psychology and master's in public policy. Prior to working for Congress, she worked as a researcher and therapist focusing on resiliency in children and families. As I said, we have brought you a dynamite panel today. I'm very proud to present them. Now we're going to shift and find out who's on as our audience. If you would, Stacy, let's poll the audience. I'm not seeing the poll. Is anybody? There we go. Just give us an idea. What is your role in workforce and childcare? Oh, you guys are good and fast. Fantastic. A lot of workforce board staff, other workforce professionals, and a couple of workforce board members. Thank you so much for being with us today. Let's see. So the bulk, workforce board staff and other workforce professionals just shortly behind that. Perfect. Question 2. Stace, not seeing question 2. There we go. What is your primary interest in attending this event? That's very important to us in planning other webinars for the childcare aspect of our work. For those of you who can't recognize, I came out of the Texas system, working for the last 34 years as the CEO of the Workforce Solutions Greater Dallas Board. We had childcare for the last 20 plus years. The childcare assistance program in Texas runs through workforce boards. So Jesse knows firsthand about this money and the flow. Okay, primary interest in attending the event is to grow partnerships between workforce and childcare. Amen, amen. That is what we're here for today. We know we're going to have much less money to spend on support services that come directly out of WIOA. Therefore, we need to make friends with our partners who have resources for working families. Looks good. Question 3. Here we are. What percentage of your customers are young parents age 16 to 24? And I know this is a hard one, but I'm not sure it gets a big thumbs up. I think we're interested if you're working directly in youth programming. Yeah, our customers are still, they're childbearing age. They're people who are in that grouping of people having babies when you really don't make enough money to afford the child care. Yeah, it's kind of a tie, 25 to 50%. That's the bulk. And not sure. Appreciate it. And one last question. How would you describe your experience with child care assistance programs? Extensive, more than 5 years, next to the field, support role, involved through family-centered programs, 2GEN, TANF, SNAP, any of those programs where we're trying to affect both the child and the parent. Looking good, guys. 35% have 5 years plus involved in family-centered programs. That's wonderful to hear. We want to know a little more about that. Probably next month, our biggest focus will be on employers who are actually engaging to help their workers pay for quality childcare. Quality childcare has to be accessible and safe and a learning environment for our children. All right. Thank you, Stacy. Some good results, guys. We're done with polling. Anybody else still seeing polling? No? Okay. Can you see the deck screen? Having a little trouble. There we go. Thank you. I think it just stalled for the polling. Okay, we've done the introductions. We're going to have a conversation. Dr. Friedman is going to go first, and she'll introduce Bob to go, and then Jesse. And if time permits, we'll do the Q&A. We do have a chat. Please support us by giving us your questions as we proceed. If we have enough time at the end, we'll answer. If we lack that time, we will come back to you with a Q&A in writing. This is being taped, and it will be available shortly. We're really good about that, and the tapes are usually easily found on our website. Having said all of that, I want to turn it over to Dr. Ruth Friedman, Senior Fellow at the Century Foundation. Dr. Friedman, take it away.
Thank you, Lori. Good afternoon to most of you. Good morning to some of you. I'm happy to be with you. Today, let me just get my screens all set. So as Lori mentioned, I am a senior fellow at the Century Foundation in Washington, D.C., where I work on childcare and early childhood policy. I ran the Federal Office of Childcare at the Department of Health and Human Services during the Biden administration, where I oversaw the administration of the federal childcare program. So today I'm going to give you a brief overview of the federal childcare program, including an overview of where things stand today and some of the opportunities and challenges ahead. So you can move to the next slide. Before we dive into the federal child care program, I want to level set on the child care system in the country more broadly. As you are all probably acutely aware of, we have a real child care crisis in the country. Child care is really expensive for families. In almost all states, families pay more for child care than housing or food, and the cost of childcare is rising faster than inflation. Having one infant in center-based program generally costs more than in-state college tuition. The high prices really strains family budgets. It increases debts for some families. It reduces savings for others and reduces the quality of family life. It reduces parents' general well-being, and it can lead to underemployment or unstable employment. Because there isn't enough childcare available, families really struggle to find care that fits their work hours and family needs. Half of families live in childcare deserts where the need for care greatly outnumbers available spots. Childcare for infants and toddlers, in particular, care appropriate for children with disabilities, care in rural areas, and care during non-traditional work hours is particularly scarce and difficult for families to find. And on the provider side, most providers are really struggling to stay afloat and stay fully staffed. This is because they can't pay staff enough to keep them, and they can't meet the rising costs of rent and pay utilities and insurance and everyday goods. So basically, they are straining to keep their doors open because parents can't actually afford to pay the true cost of care. So providers have to charge less than they would really need to charge to pay for covering stable operations. There's also a real child care worker shortage in this country because compensation is so low. Providers tell me all the time that they are losing their staff to places like Costco and fast food, and that is contributing to the child care shortages in this country. Next slide. So the federal child care program is not designed or funded to address the scope of the country's child care crisis, but it is incredibly important. I do want to note that the name of the program can be a little bit confusing. In DC, we call it both CCDF, which is the acronym for the Child Care and Development Fund. We also call it CCDBG, which is the acronym for the Child Care and Development Block Grant Program. But states use their own names. So for example, it's called CCAP in Illinois and Kentucky. It's called the Best Beginning Scholarships in Montana and the Child Care Scholarship Program in New Hampshire. So in your state, you probably have your own name. It's now funded at $12.3 billion annually. That has more than doubled in the past 10 years. Funding goes directly to state, territory, and tribal governments by formula. Nationwide, it provides childcare subsidies for about 1.3 million children under 13 every month, mostly in the form of vouchers. Those states can also provide subsidies and grants and contracts directly to childcare providers. Families need to be provided, engaged in work, education, or training to be eligible. Those states have a lot of flexibility to define what those activities need to be. The federal threshold for family income eligibility is 85% of state median income, but states have flexibility to set that lower, and many do set it lower than that. The federal law sets minimum health and safety standards for childcare, though states tend to set those higher than the federal law. States are required to spend at least 12% of the federal funds on activities to improve the quality of childcare. You can go to the next slide. So each state has to outline its child care policies and plans every 3 years in what is called its CCDF state plan. It has to submit these plans to the Federal Office of Child Care for review and approval for compliance with the federal law. The slide here on the screen lists the different policies the plan speaks to. And I want to note that there are requirements for states to solicit comments from stakeholders in states in developing its triennial plans. It also has to publicly post these plans on its website so that you can have a better understanding of the child care subsidy plan and its program and policy. I'm not sure if these slides are distributed, if you registered for this, but I do have this hyperlinked. And after I finish talking, I can actually put the hyperlink in the chat so you can look up your state plan if you are interested. One of the questions in the state plan that may be of particular interest to you that I wanted to point out is that states are required to describe how they are going to coordinate with the agencies responsible for employment services and workforce development, and are supposed to describe the coordination goals, processes, and results. This question is 1.1. You don't have to remember this. I will also put this in the chat when I'm done talking, but it's question 1.1.A7, and they have to describe it. They also have to do this and describe it for how they're coordinating it for the TANF agency, which is something that can be very useful for you as you're thinking about what opportunities may be available for you. So the CCDF program requires states to ensure their policies allow families who receive subsidies have equal access to care as families who do not receive subsidies. This is really important because it requires a certain level of accountability in how states run their programs. But states really struggle with this because there is not nearly enough CCDF funding to serve all families who need help affording childcare. Only about 1 in 7 families who are federally eligible receive assistance because of lack of funding. So there has long been this tension for states on how to balance addressing serving all the families who need the assistance. As I mentioned earlier, federal family income threshold is 85% of state median income, but states typically set it, or a lot of states set it lower, and many states have wait lists. Other states don't keep wait lists, but just don't have eligibility policies that reach families who need the assistance. And many states have paid providers much too little in order to be able to give subsidies to more families. One of the things that has happened over the past decade is that both the federal government and states have realized that we have really had to right size the balance of the program more to ensure that enough money was going into basic health and safety and lifting the quality of childcare. During the Biden administration, we told states that they were paying really these bottom basement rates to providers and that it just could not continue. It was too destabilizing to the sector. Providers couldn't stay open and they couldn't keep staff. And parents really were not having real choices in their care options. And it just wasn't tenable. So we partnered with states over the past 4 years to raise provider payment rates and improve the ways that they were paying providers to try to make sure that the federal program was doing all that it could to help stabilize the sector. You can move to the next slide. There are many discussions going on in DC about what to do about America's child care crisis. Democrats in Washington recently reintroduced their vision about what should be done. Members in the Senate and in the House have recently reintroduced this legislation that they have put forward the past few Congresses. This bill, called the Child Care for Working Families Act, would fundamentally transform the child care system for most families in America so that most families would pay nothing, and no families would pay more than $10 a day. It would also improve childcare wages for the workforce so that we could address the very serious childcare worker shortage that exists, as well as building the supply. There is not bipartisan support for this approach, so this is not something that would pass Congress anytime soon. You can move to the next slide. There are three more immediate things to keep an eye on in the future. The first is the annual spending fight for fiscal year 26 for the CCDF program. The federal fiscal year ends in September, so the Republican-led Congress is a bit behind in passing its spending bills. This is something to watch in the press. We will all be watching to see what happens. CCDF will be a part of that. The second issue to watch is that Trump officials have recently said that they intend to reopen a Biden-era child care regulation that was intended to help child care providers. We passed a regulation last year requiring states to pay providers on time and more fairly. Trump officials have said they want to undo this regulation in order to give states more flexibility. I expect public comment to open on that in the next couple months, so that is something to watch for. And the third issue is to watch the impact of the recent tax bill on child care. I think it's pretty clear there will be a net negative impact on child care for a few different reasons. Just in the interest of time, I will hit on two. One is about a quarter of the childcare workforce relies on Medicaid for health insurance. And early data analysis shows that this group is going to most likely take a pretty big hit on losing their health insurance because of passage of this bill. So it's pretty likely we are going to see that the childcare workforce is going to lose health care because of this bill, which is likely to make the childcare workforce shortage worse. And secondly, there's a pretty big shift in cost from the feds to states. As state budgets take a hit, we will be looking to see what happens to state investments in childcare pretty carefully, and that is something we will be watching. And so with that, thank you so much for the time today, and I'm going to pass to Bob. Thank you.
Thank you, Ruth. First off, I want to say that Lori and I have worked together many years, and we have a similar starting. I started as a workforce planner, however, and for all of you workforce planners out there, I read that in a few years, artificial intelligence will take our jobs away. As started, that first rung on the professional ladder is in deep threat. And when I think back about what I did, I suppose I should worry, because I did a lot of things that I imagine AI is doing already, much less what it can do in 2 or 3 years. But having said that, my fellow panelists know a lot more about childcare than do I, and I've learned a lot by being on this panel and the opportunity to talk with them. I'm going to view this from a workforce side, because it's the side I know. And so I want to start by saying, what are the 3 or 4 biggest problems in workforce today, writ large as a system, not necessarily for WIOA or those of you who work with boards, but as a larger system, which includes community colleges and our social safety net and our education system. Well, it seems to me at least three of them might well be, how do we train, educate existing workers to stay productive in a vastly changing workforce where AI and other technology are going to make the world look much different. So adult learning becomes bigger than ever, it seems to me. Second, how do we create more good paying jobs? That was an interesting aside, I think, to the previous presentation. Can we turn childcare jobs into good paying jobs? Because it is a challenge in the country across a whole variety of areas to create that. And then third, and the one that I thought I'd focus on a little more, is how do we grow the economy? Historically, we've grown the economy primarily through immigration and migration of African Americans out of the South over a period of 75 years are the 2 drivers of economic growth in the country, allowed economic growth to occur in the country. And now it looks as though, at least for a few years now, immigration doesn't become part of that. So it seems to me we start to look at what are the major barriers to growing the workforce? Who's not in the workforce that could be there? Or who's in the workforce but very unstable in their position? And one bad incident can lead them to be out of the workforce. So how do we reach out to those groups? Well, childcare is obviously the biggest of the 3 or 4 major barriers to employment, excluding issues of dependency among people with disabilities, which I treat as another big but separate issue from this. And if we look at the statistics right now, we see that at best in Texas, they serve maybe 11% of the youth who would be eligible for some level of support, and that what we end up with are waiting lists, and around the country they can be months or even years of next. So one of the things I wanted to say is it seems to me part of what we have to have occur here, and I've worked with boards now for a long time, is we need leadership in the workforce system. We need models, we need good ideas, we need partnerships, but first of all, we need leadership. And the question becomes how our boards become part of that leadership network, which includes state and local elected officials, education leaders, and others. If we're going to take on the biggest challenge we face, which I think probably is affordable, available, quality job care for young people, then it's going to take a larger issue than just WIOA or just changing a few things. So one of the things that I think about is, how do we get boards to see this as a way that growing the workforce is a major challenge as a policy issue for them, and grabbing all the resources out there to do that and all the people and institutions to do that, it becomes one of their challenges. I leave the design stuff to all of you as staff, because you know that better than any board ever would figure it out. They don't need to do that. The board needs to lead, and the rest of us get to roll and make it happen. What I wanted to spend just a minute, though, is There are as many acronyms in childcare I've discovered by reading this as I thought we were leaders in workforce. And the first rule I'll say in trying to sell this is you've got to get rid of all the acronyms and all the but this and but that. It works this way except when it doesn't. You know, all of that just confuses an audience that needs to be your supporters, and we need to find language that works. So one of the things is to help our boards and our communities understand the challenge of it. And so we did a little case study of, and if you go to the next one, a single head of household in Dallas who has one child. And we just looked at, she has a $36,000 a year job, which probably is not uncommon for a young female worker in this society, probably a young male worker as well. So she has $36,000. And if she has two children in this case, if she has one who's a toddler and one who's in school age, it's almost $20,000 a year. This has probably gone up since this was done, so it probably is $20,000 a year. And she actually ends up with a negative income once you build in rent. And we haven't even talked about food or transportation or the cost of working, et cetera, et cetera. But when she gets a subsidy at the 85, as under an 85% rule, and she meets the income requirement. And I don't have to go through this whole chart because you can download this and use it in your community with your numbers. But at that point, this person, it's a she or a he, will have $11,000, which doesn't make them rich by any stretch, but at least that gives them some room to have some things go on. So the value of that subsidy is huge. Now, if we switch on the next two slides to, if we go past this now, if we have two parents with a school age and a toddler, same situation, but now we have two parents, we have a lot more income. We still have a couple here who are qualified in Dallas, at least at this point, as being under the 85% of the 50%, which is about 40% if you want to play with numbers. And they end up with a fairly substantial 46,000. Not that that makes you rich either, don't get me wrong, but so it does indicate that a couple with two good incomes, or at least moderately good, well, let's not call them good, but let's say that they are moderately good incomes, can actually support themselves with a subsidy. But even without the subsidy, they have some money, but the subsidy really adds 15,000 or so to their income, which is a huge bump for somebody living fairly marginally. The other thing is with two incomes, and I guess I want to go to this in the next slide, is after affordability. So we can obviously see that affordability is the biggest issue, but my argument would be, how do we make our communities understand that affordability issue for people that work? Because there tends to be a view that all the people that get the subsidies don't really work anyhow. So that's number one. And number two, for the workforce community, it becomes a case management. How do we keep folks in these jobs working? How do we give them skills to get better pay over time? How can we make that work so they get more money? But how do we avoid the cliff benefit, which is a whole different discussion that we won't go into, but where they lose their child care. And remember, if 85% is the highest number, but most states are quite a bit below 85% in terms of the percentage of the mandatory of the wage, family wage, individual wage average. In addition, availability is part of what I say. How do you grow the workforce if there's no availability? So how do you grow availability? So you really have a two-sided issue. You're looking at jobs for people in childcare, and you're looking at people who need childcare. How do you balance those two sides? So both challenges that I see workforce boards working on in partnership with a number of other organizations. And this show, I think Ruth went through most of these issues here: emotional and mental health goal. There's developmental risk for children in low quality care. And yet there's huge research to show benefits to young people that are in pre-K and other kinds of childcare in terms of future advantages in education and earnings. And then there are economic ripple effects because people in these unstable positions, when the kid gets sick, something happens that doesn't work right, they don't go to work. And then we have a ripple into the company and the employer community as well. So how do we talk about those things? If we can go to the next one. So we know we have a fragmented funding system. I would love to say we're going to figure out a way to find more money. We're going to have to find a way for people to demand more money because we're not going to figure it out in the current political environment. But it's the fragmented maybe can be brought together. How do we bring underinvestment at the state level in? And we have an unsustainable business model. And on the other hand, if you ran one of the childcare company, how would you pay people more? You're only going to get what's being paid here. And then on top of that are limited access. So what you want to do is create a board work that starts to look at all these issues in partnership with a variety of others. And if your board's not the right person to be the leader, it might not be the right organization to be the leader, then you want to find how you partner with others that might be more appropriately out front on this issue. And the board comes in with the workforce services that fit into this. If you go to the next one. I think one of the things, and you're going to hear from Texas next, is to have referrals and cross-trained staff in your career centers. Certainly boards can insist that happen. That you have supported job search for people that are using childcare. If you're using childcare, there ought to be a supported job service. That we start to collect data. That we know what's working, what activities people in, what are the outcomes of participation. I was amazed in looking through data how little we actually know about what happens to both the young people in childcare and the parents who are working or not working, as the case may be. And then finally, we meet families where they are. If the career center is not the right place in your town, set up services at the library in the right place or at a CBO in the right place. We are no longer tied entirely to saying we have to have this one big comprehensive center and everybody has to go there. We can start to talk about how do we move these services into the community. And the call to action to me is to partner with your state and local child care administrative agency on what needs to be done. Make sure that you have the best referral processes you can and support training for parents and upskilling for parents and efforts to keep parents at work. And I would, the last session talked about apprenticeship. And while apprenticeship doesn't necessarily improve wages, I think it does give workers some room to argue for wages because based on their education and training. And it may be a possible improvement going forward. So I think in the end, it becomes a call to action for legislation and public policy to change. And the last piece I'll leave, because I know it's next week's, the next time's trade is, I think we look at the business community. They have a huge role to play in this. They are natural partners to the workforce board, and they are the voices that can help change some of the realities that we face today. And if we go to the next slide, it's Jesse, you are next.
Okay, thank you, Bob. Appreciate it. And like Lori mentioned earlier, so I'm the boots on the ground here in our Borderplex area. And so what I'm going to go over today is just some of the things that we're doing to connect with parents to help them upskill, right? As Dr. Friedman and Bob mentioned, childcare is very expensive. And so we want to find a way where we can help these parents upskill to the point where perhaps they don't need childcare services anymore, right? But I'm going to give a quick overview of the Workforce Solutions Borderplex, and then just a quick snapshot of our parents, and then I'll get into specifically the things that we're doing. So Workforce Solutions Borderplex is one of 28 workforce development boards here in Texas. We serve the El Paso, Hudspeth, Culberson, Jeff Davis, Presidio, and Brewster counties. Now, it's approximately a little over 21,000 square miles, which makes it unique, considering that most of our region is actually rural, right? So that presents a lot of challenges in itself, being so much rural area. But we're able to connect to all of our customers through our program sectors, like our business solutions, our Next Force, which focuses on youth, Joint Task Force, which is for our military and veterans, and then of course our Care Force, which is where we focus on childcare services, or CCS, as I'll call it throughout the presentation today. But a quick snapshot, as you can see on the screen, we've served over 9,000 children this fiscal year, so it's a little over 5,000 parents. But what you'll notice here is a lot of those parents are 96% are female, right, versus 4% male. And a lot of these children are in single parent homes. So 91% of these children are in single parent homes versus two parent households. The average income, a monthly income, is $2,900, which is about $18 an hour. And a lot of these individuals, about 77%, as the graph here shows, only have a high school diploma or equivalent. Next slide, please. So here we have the education and employment and salary quartiles here for the El Paso metropolitan area. And so a lot of our parents that we serve are in the lower two quartiles. As I mentioned, the average income is a little over $18 an hour. So if you can see here on the blue section, they would be about in between the second and third employment category there. In actuality, a lot of El Paso, roughly about 70% of the El Paso area is in the lower quartile. So it really, there's a lot of challenges, a lot of opportunities is the way that I like to see it, a lot of opportunities to help these individuals move up into these higher quartiles. Next slide, please. Okay, so a lot of our non-participant potential workforce, as you can see on this slide, do not work because they have to be caregivers for their children, right? And as you can see here, it is disproportionately women versus male, right? And a lot of them have to stay home to be caregivers because the cost of childcare is very expensive. The average cost in the area is roughly around $10,000 per year. Other barriers that they're facing are perhaps evening childcare. Some individuals may be able to work. Perhaps they would like to work more. Perhaps they'd like to go and pursue some educational opportunities, but they're unable to due to not having access to childcare after hours or evenings. Or in some of them may also be in childcare deserts. So they may not have the opportunity for childcare. And so next slide, please. Okay, so what led Workforce Solutions Borderplex to focus on upskilling parents that we serve? So a little over a year ago, we came across a parent that had been on childcare services for 17 years. And so as a board, we had to ask ourselves, did we help this individual? Did we help this parent? Or were they just a transaction? And the simple answer to that is no. We did not help that individual, perhaps in upskilling in different opportunities. And so as we started looking at the data, we said, okay, there has to be groups of individuals we can help upskill. And so going through the data, we did find that there were a group of individuals that that had bachelor's degrees, but were not making enough money to pay for childcare service. And so these individuals happen to be teachers' aides here at the schools. And the average income for a teacher's aide in the Borderplex region is roughly around $30,000 per year. And so we said, okay, how can we help these individuals? And so we reached out to these individuals and we said, okay, we want to help you. We want to help you upskill and provide a better opportunity for you and your family and your children, right? And so what we did is these individuals have enrolled into alternative teaching certifications. So this is one way that we help is by having them enroll. And we have one parent who is actually enrolled here at the University of Texas at El Paso in the special education program. And so when they complete the program, they will have their teaching certification. And they will be able to earn roughly around $60,000 a year, right? So just having this one individual upskill a little bit, get their master's, get their alternative teaching certification, we've now helped this individual that perhaps will not rely so much on CCS, on childcare services. We also have another individual who is also attending the University of Texas at El Paso to receive their alternative teaching certification, but they're doing it online. As I mentioned a little bit earlier, a lot of individuals may not have access to after-hour or evening childcare. So what this parent is doing in particular is doing it online because part of the requirement is to do in-person Wednesday and Saturday, and they are unable to because they do have a special needs child at home, and so they're doing it online. But they've been great at it. They're succeeding. Hopefully, next year they'll graduate and they'll be able to start teaching, and that will be a good success story that we're hoping that we'll be able to share a little in the future. Next slide, please. So Bob had kind of touched on this earlier, community outreach and engagement. So some of the things that we're doing is we're really trying to connect with parents where they are, right? The easiest way for us to connect with these parents is at these child care centers, right? We have a great outreach team through our contractor. And so we set up several events throughout the month, a good 14 or 15 events where we go directly to these centers and talk to the parents. We tell them about the different opportunities we have, whether it's finding new job searches, or if it's upskilling, whether through education. So we're going directly to these parents versus having the parents come to us. A lot of parents, a lot of individuals don't know what workforce boards do. In particular here in the Borderplex region, a lot of individuals may not know everything that we can do besides childcare services. I know we may be unique here in the state of Texas where our boards do have childcare services, but there are so many different avenues that they can take. Another thing is we're focusing on the lowest incomes by zip code. As I mentioned earlier, a lot of our parents are in those lower quartiles of income and employment. So we try to focus on those. This way, we can help those individuals perhaps find new employment, educational aspects. So we have to really focus on those groups of individuals or those areas of need, so they have an opportunity as well, right? We're also working with different partners across the community and a lot of community-based organizations. What we'd like to try to do is really connect with them and see how we can help them. And Bob had actually also mentioned this as well, referrals and job fairs, right? We try to refer a lot of our parents into some of our other programs. I know Lori had mentioned earlier a little bit about WIOA. And so there's a lot of different opportunities that we can do with those referrals. And so job fairs as well. We try to share those job fair opportunities with a lot of our different parents. So we send a lot of email blasts to try to connect with them and let them know, hey, here's job opportunities, here's some hot job opportunities. And so hopefully a lot of them will participate and then have a better outcome with an employment opportunity. And so next slide, please. So some of the things that we're working towards in the future. So we're really working with employers directly to upskill their CCS parents that work for them, right? We try to settle them that we want them to have a more well-rounded, trained individual, and so a lot of organizations will open their doors and say, okay, let's talk about it, right? Because some of them feel it's a sales pitch, but it's not. We're trying to help that organization, but we're trying to help the parent. So we're working directly with certain organizations. An example I can give is we're working with one of our local hospitals here. We have a lot of medical assistants, and they make roughly around $15 an hour, but we want to help them upskill to be LVNs or RNs within that hospital, right? And so we do have one hospital that is on board. So we'll get started on that here soon. We also working with different organizations, even some call centers, as an example, or some of our childcare centers. As we've mentioned, a lot of childcare workers do not make a lot of money. And so we're really trying to help them with different educational opportunities. We're providing stipends to them for some of their training, different retention stipends, right? So we can keep the good workers, childcare teachers at those centers, but also reward them for staying there and helping out that childcare center as well. Apprenticeships, we're looking to start different apprenticeship pathways for those childcare workers and some for parents as well, right? There's a lot of different things we could do. I could go on for a long time, but I know I'm limited on my time. But apprenticeship programs, it's something that we're looking to do. And then, of course, legislation. I know we're trying to work on a bill here. It's a pilot program where we could get some more after-hour evening care, right? There's a lot of individuals who could use that. And so that's another way that we're trying to really help here in the Borderplex area with connecting with these parents and providing a lot of different opportunities. And so, again, I would love to keep going because we have so many other great ideas, and perhaps maybe on another panel I can speak a little bit more. But that's all I have for today, and so I'll pass it back over to Lori. Thank you.
Thank you, Jesse. Thank you, Jesse. I can't tell if my mic is working. Stacy?
It's working.
Thank you, dear. So appreciate all, if I can just stop changing slides. So appreciate all three of you who joined us today, and the audience. The audience, you guys have been great. There's a lot of sticking power here today. Mala Thakur is with us. Mala is the director. She's the senior director of programs at NAWB and my boss. And Mala, are there any questions in the Q&A or clarifications? Anything you want to say?
No, I don't see any questions, but I see people sharing information. Hello, everyone. But yeah, no questions at the moment.
Thank you. I also want to give a little shout out to the agencies that allowed these people to work with us today: Century Foundation, Equus Workforce Solutions, and Workforce Solutions Borderplex. These organizations are constantly looking at childcare. Childcare is a very big issue, as you keep seeing from these different webinars. It's not just a support service. It is something very critical to keeping our workforce engaged, keeping people working, and filling gaps in employment. It's also important that we have quality childcare and education as I always say, our 3-year-old today is our workforce in 15 years. And I've been at this enough 15-year cycles to think that's really critical. I believe we are almost at time. I would offer kind of closing remarks, but I think Stacy would like you all to look at the upcoming events that we have. NAWB is very busy these days, and AWB provides a lot of activity during the summer, our summer socials, lots of different things on this list, including our next webinar in childcare. Please tell your friends. Let's see if we can get a few more people joining us. Spread the word. Childcare is important. It's not affordable in your WIOA dollars, at least not long term. As a former director, I'm very conscious of that. And even if you don't have legislation, I think Dr. Friedman has provided you with a lot of resource today on how to track down who in your state and your region is in charge of the Child Care Assistance Fund. Having said all that, thank you again to our panelists. Thank you to our audience and to our tech people. Stacy doesn't get a shout out very often. She is the Director of Communications at NAWB. Stacy, thank you for the day. Appreciate everyone. See you next time.